the most important thing is that every patient being diagnosed with RLS should have a blood test, always. And what do we want to check? We want to check iron parameters, ferritin and transferrin saturation. But it is very interesting that most of RLS patients have normal iron parameters in the blood sample. So we are not talking about peripheral iron deficiency, but brain iron deficiency. And for this reason, although in the blood sample we can get normal iron levels, we should recommend iron supplementation to increase iron levels and try to improve brain iron deposits in this patient. And the options are very wide, because we are still recommending to initiate iron replacement therapy with a transferrin saturation index below 45%, which is mostly every patient with RLS symptoms. The only contraindication for receiving iron, the most important one, is to be at risk of producing iron overload. But this is very rare and it's anecdotal if we are always within the safety limits of iron supplementation. For that, although we are trying to revert or to correct brain iron deposits, we always need to check peripheral iron, because if the patient shows something about high iron in the blood, or this patient could be at risk of developing iron overload. So for that reason, we always have to keep below the safety cutoff points for starting iron supplementation.